We're taking a look at what's happening at our state capitol. Maine's legislative session is in full swing at the State House in Augusta, and here with us to discuss some legislation impacting mental health is Sweetser's president and CEO, Jayne Van Bramer. Jayne, thank you so much for coming in today. We appreciate it. Workforce challenges have been mentioned by many as a barrier. So what could the legislature do to address that?
Sure. Well, we can't have services without staff. We need a blueprint for supporting Maine's future behavioral health workforce. A workforce task force should be created to bring stakeholders together to evaluate the workforce solutions that are being used in other states and to explore the feasibility of initiatives like stipends for internships in fieldwork placements, loan repayment programs, and really to empower providers to take on an enhanced training role that reduces barriers, costs, and gets students more quickly into the workforce. In addition, we need to make it easy for out-of-state licensed clinicians to come to Maine and work for a behavioral health organization. Immediate reciprocity, if you have an out-of-state license and are currently working, would really help. In addition to alternative pathways for licensure. The need for clinicians right now is dire. In Maine, there are over 10,000 people waiting for clinician services. So the time to act is now. This is an ever-growing need.
Yeah, and as you mentioned, the demand isn't going anywhere.
It is not going anywhere, exactly.
And speaking of, for young people and families struggling with finding therapy and support, are there any initiatives needed there?
Well, last year, Sweetser opened the state's only Child Act Team, which stands for Assertive Community Treatment. You know, the Department of Justice specifically called out Sweetser's Act Team as being a benefit to the state and previously noted that it was a gap in services. The model is a best practice, and it is geared at those children that have not been successful in lower levels of care and are at risk for institutional treatment. They're at risk for going into a hospital, for going into residential care, or needing crisis services. The goal is really to work with the child and family to develop treatment interventions and strategies that allow that child to stay home, to stay in their community, and there is support available 24/7. So we are working on a proposal with Assistant Majority Leader Representative Lori Gramlich to create 2 additional Child Act teams in the underserved areas of Bangor and Lewiston, and we're really excited to get that kicked off.
And you know, as we continue to talk about funding cuts on the federal level and here on the state level as well, we have a budget shortfall. What are your concerns around? I mean, I'm sure there are many, right? But what are the, you know, if you could prioritize them,
Sure.
What are the concerns around that?
Well, I am concerned, and there is a lot of uncertainty right now. You know, we are spending hundreds of thousands of dollars housing children in emergency rooms, sending them out of state. They are sometimes housed overnight in an office and in a hotel room. So first off, I'd like to say we have the money, we're spending it in the wrong place. But certainly the state needs to pass the supplemental budget and to close the MaineCare funding gap. In addition, the cost of living adjustments that were promised to providers effective January 1st are not included in the budget. Just for Sweetser, that translates into a $600,000 loss, which will mean we can serve less children, less adults in need of services. So I would ask the legislature to pass the supplemental budget and to ensure the COLA is included in 2-year budget negotiations.
There's some really deep impacts here. Jayne Van Bramer, Sweetser's president and CEO, thank you for joining us.
Thank you for having me.